To start live. Okay, so good evening to you all, and welcome to this series, the initiative taken by ISF College of Pharmacy. And this initiative brings out to cover the whole syllabus curriculum of pharmacy practice B Form 7th semester, which is 703T. And I would like to acknowledge the ISF College of Pharmacy management, higher officials, directors or principals are all the staff, and the coordinators of the program, Dr. Kamaljeet, Dr. Abhishek Vijukumar. Every day you will be getting a link in the group. You have to join. Every day 2 lectures will be covered. So today is the first one, hospital and organization. And before going to it, I would like to welcome you from ISF College of Pharmacy on behalf of ISF College of Pharmacy, Department of Pharmacy Practice. And so one of the department where we're running all the clinical activities, like we do have 4 types of courses. One is PharmD 6-year program, one is PharmD PB 3-year, one is MPharm 2-year program, and another one is B-Pharm practice. College started in 1984, and this department established in the year 2011. And particularly when we talk about this department, it's our will and wish to understand that particularly Department of Pharmacy Practice in India, in diploma you have 4 syllabus subjects. In B Form you have 3 subjects, one in 7th, one in 8th, and 8th one more elective one, as well as in PharmD you have 8 clinical subjects. In MPharm practice 8 subjects. So total 23 subjects are there for pharmacy practice in the various syllabus schemes of Pharmacy Council of India. Hence, our department is having drug information, patient counseling center, model pharmacy, record room, basic life support facility, etc. And we do expertise in the TDM, ADR monitoring, drug-related problems, drug interaction, medication assessment, ward rounds, J-clubs, case presentations, prescription-based exercises, and rationality chart for the clinical and the paraclinical domain in terms of patient care and pharmaceutical care, which we enhance as the evidence-based medicine. We have MOU like with various hospitals, Civil Hospital, SG Thapar, Guru Gobind Singh Medical College, Fortis, Medicity, Garg Thapar, JSS College of Pharmacy, Mysore, etc. And very proud to announce we have Human Ethics Committee registered by CDSCO and Department of Health and Research. And we do also have the SPORE student chapter. And this student SPORE chapter is an International Society of Pharmacoeconomics and Outcome Research based on the health economics and outcome research globally. Working on to the basis of pharmacoepidemiology and economics, as well as the evidence-based medicine, where I am serving as faculty advisor, and our president, Dr. Kamaljeet, and secretary, Dr. Abhishek, who is helping me out to organize this all for you guys. As well as we have the one of the achievement in terms of ADR monitoring center in our department. Every month, under the banner of Pharmacopoeia Commission, we are reporting out 100 ADR adverse drug reactions to the government of India, the National Coordinating Center, Indian Pharmacopoeia Commission. And for that, Department of Pharmacy Practice have 2 dedicated staff. Mohammad Hanif is a deputy coordinator taking care of this whole ICS along with me. And our alumni is placed well in all corporate hospitals like Radiation, Fortis, Max, Essentia, TMU, various institutes in various capacity as faculty like Chitkara, Adesh. And they are working on some CROs like Praxel, AccuScript, ICANN, Overseas, and many more to name. So this was a formal departmental introduction. My dear students, first of all, I would like to welcome you, and I would like to congratulate you to participating in this pharmacy practice subject. You are learning it as a subject. It is a practice domain in India. You have hospitals, you have the medicines, you have the informations, and particularly there are people who are suffering, who are ill nowadays, and they visit to the hospitals and the clinics to gain the network of the medical help. So when they get a medical help, they get a diagnosis. After the diagnosis of confirmation, they usually visit to a pharmacy store where a pharmacy is sitting. Okay. And there you are doing the dispensing, responding to minor ailments, your vital signs are checked, etc. Things place up. And counseling, dispensing, etc. Everything, whenever you are learning anything, there are some certain objectives, learning objectives, when you need to know that you are learning for the purpose of knowing the medicines, knowing the uses of the medicine. You need to understand how to particularly set up a molecule for use, hospital pharmacy, and making a list of the medicines available in the hospital formulary by pharmacy and therapeutic committee also. You also get with the patient with medication history interview and counsel the patient. There are 8 drug-related problems, including ADR, drug-drug interaction, drug-food interaction, polypharmacy, overdose, underdose, and missed dose. So you go for the adverse drug reactions monitoring also. You go for the selected laboratory results also. Somewhere misdiagnosis takes place. So laboratory confirmation, therapeutic confirmation, radio diagnosis, biochemical diagnosis, certainly sometimes biochemical, etc. No pharmaceutical care services, patient counseling in community pharmacy, and you need to appreciate the concept of rational drug therapy also. Pharmacy Council of India has given the syllabus in 5 parts, and in the 5 parts you have particularly this things. If you see is as 10 hours first unit where you have 10 lectures, and into this 10 lectures particularly you have this property to understand that you are in the first unit and you need to know the hospital pharmacy, the adverse drug reactions, interactions, casualty, community pharmacy, dispensing of the proprietary non-proprietary products, community pharmacy and maintenance of various records. Similarly, module 2 had 10 hours, lecture 11 to 20, where you are going to see the distribution, formulary, pharmacy and therapeutic committee, therapeutic drug monitoring, medication adherence, medication patient adherence, and community pharmacy management, dispensing of controlled drugs. In module 3, again 10 lectures, PTC, drug and poison information center, then definition of patient counseling, role of pharmacist in training and education, internal and external training programs, services to the nursing homes, clinics, code of ethics, prescription medication order, communication skills, etc. In module 4, you are going to see out that budget preparation, implementation, clinical pharmacy, and drug therapy monitoring, pharmacist intervention, and many more things. And particularly, you go with many more things like ward round, and in particular, after the ward round, you are over-the-counter drugs, P drugs, prescription drugs. After the prescription drugs is K drugs, that's controlled drugs, and narcotics. And you are in a case of over-the-counter work as a prescriber. Then in the module 4, and sorry, this is module 5, you have some lectures where you go with the inventory, Marg software used in India, the store management, purchase, procurement, methods used for analysis of drug expenditure, description, principles involved, classification, control, identification, role of hospital pharmacist, advisory committee, interpretation of clinical laboratory tests, biochemistry, hematology. So the curriculum. So in your teaching learning process, total you have 5 units. Unit covered unit 1 to 3, 10 lectures. lectures, unit 4 and 5 to 7. Total assigned lectures for the Pharmacy Council of India is 45. And your student engagement part is assignment per unit. If you have any cross question, you can WhatsApp me, call me after the class, also during the class in the text chat box, also on the YouTube live. Study material every day after the lecture you will be provided as per the requirement, and you will be provided that particularly PPT. So to start with this, within this pharmacy practice domain, you have like medicines. Before going to medicines, you have the human anatomy, various routes, and there are various rules, pharmaceutical jurisprudence to administer the medication, to store. You have controlled molecules, you have look-alike, sound-alike drugs in the domain, the medical store. Another term is pharmaceutical pollution, where the safe disposables of unused and expired medicines takes place. What are the legal requirement and request and registration and license? So in India, typically there are 5 types of pharmacy practice. All eyes and ears to this. I'm telling community pharmacy, it is 3/4 in the country. And when I talk about the 3/4 in the country, you need to understand that it is particularly one of the major way back where the person initiating telling that pharmacy practice is one domain where the 3/4 people lives and goes to the community pharmacist. So community pharmacist is one person who is dealing in the community with the peoples. In case of over the counter, the community pharmacist is directly a prescriber. So the community pharmacist is the one pharmacist who takes place for the community purpose. The second pharmacist is hospital pharmacist, which is basically floor stock and centralized system, and it is typically 16%. So the 16% hospital pharmacy peoples at the floor stock and centralized level works. Then comes up is a clinical pharmacy. So the clinical pharmacy is 5%. And what happens in the clinical pharmacy is you work in the NABH accredited hospital where the clinical pharmacist reports to the clinical pharmacologist in a quality department where the NABH accreditation JCI 6th or 7th edition is going on, where the elements, objectives, and 11 standards of care of management of medications takes place. So clinical pharmacy is one pharmacy in the world where we do not dispense the molecule, but we check out the process of prescription, either it is rational or not, medicines prescribed are rational or not, procedures followed are rational or not, antibiotics given there, antimicrobial stewardship is enough or not. And furthermore, we look after the antimicrobial sensitivity, and we also go for rationality in terms of medication errors like decimal errors, transcription error, administration error, diagnosis error, prescribing error. So clinical pharmacy is one of the ever developing domain in the India and Asia. Whereas when I talk about the other developed part of the world like UK, US, UAE, clinical pharmacist has developed like anything, and which gives a very good impression of pharmacy services in healthcare sector. The next pharmacy is the online pharmacy, which is called as e-pharmacy. So Information Technology Act, Government of India 2000, you have to register your farm and you can practice as e-pharmacy. Whereas when we talk about the physician, either they can give the e-prescription. So my answer is yes, they can give the e-prescription by telemedicine guideline. During the COVID time, the pandemic time, the people were not able to visit the physician. So my dear students, at the time, it was a high time where the peoples were taking teleconsultation. Postgraduate Institute of Medical Sciences, PGI Chandigarh, has been established as Center of Excellence by Government of India, where they are doing excellent job role for the purpose of telemedicine. The next pharmacy, which is not written onto a scheme, is generic drug store. Jan Aushadhi Kendra. In India, there is Prime Minister Jan Aushadhi Kendra, where the peoples are on the below poverty line. They are particularly having the medicines in a very cheap rate, whereas the API remains same. So around the bureau is given permission to 20,000 Jan Aushadhi Kendras in the India. So in India, 5 types of pharmacy practice are nowadays witnessed: community, hospital, online pharmacy, Jan Aushadhi Kendra, and the clinical pharmacy. Out of 5, in 4 we are are dispensing. One clinical pharmacy in which we do not dispense, but we cross-check the rationality. There is a rule, like in army, when you go, there is a rule on the gate, respect all and suspect all. Same way, when you're getting a molecule may be beneficial and may be contraindicated in terms of harming to your body. So way back past unsafe human experimentations, there is a history of clinical trials, right from elixirs, sulfonamide elixir experiments and Tuskegee syphilis studies and many more to name. But when it comes to the hazard, it is always thalidomide. Disaster happened around 60s, mid 60s. And afterwards, in 62, the Declaration of Helsinki in the Japan, which was in the 1970, the civilization of the medicines for the safety indexing. So, pharmacy practice, when we take it as a subject, there are theoretical principles and basic concepts. And when you go to the theoretical principles, you learn into the classroom. But pharmacy practice is such a domain where you have to particularly cover it into a medical store or a hospital. So, what is the core of pharmacy practice? ADRs. You have to have a list given by WHO, so model drug list. Then you have a national essential drug list. Then you have a state, Directorate of Health has given urban, suburban, rural list. Then you have a list in the hospitals, formulations available in the hospital called hospital formulary. Then you do the patient counseling, which is of 5 types: isolated counseling, mass counseling, food counseling, diet counseling, medicine counseling. Then you should know the medicine information services. Like last week only, ranitidine has got banned due to the presence of NDMA, which causes the cancer. Then you have the medicines like P drugs, prescription drugs, over-the-counter drugs. You have to care a patient, pharmaceutical care. Then you should have various laws and jurisprudence, like you go with the regulations like Schedule H1, Drugs and Cosmetics Acts, Pharmacy Practice Regulations, etc. Then you should understand the diagnosis, various type of diagnosis like biochemical, hematological, and your this radiological examination to confirm the diagnosis of the disease. Disease state management of chronicity, acute, subacute, working in a team dynamics, paramedical, medical staff like pharmacy, physician persons, clinicians, nursing staffs, dietitians, and many more, medics, paramedics, ambulatory staffs. So there are a number of people to take care of. So drug distribution system in terms of community pharmacy or hospital pharmacy. So the inventory control socket, expiry, audit, medication adherence for particularly understanding that medication is a very important segment for particularly understanding that if the medication adherence is not proper, what will happen? A person is having a chance of relapse of any disease condition like malaria. Then the inventory control, you go with the next portion, which is inventory control portion. And in inventory control portion, you need to understand like what is the requirement of the molecules, the laboratory findings, what the laboratory findings is telling us. A disease state, acute, subacute, or chronic. If it is acute or subacute, OPD. If it is chronic state in terms of disease, we need to go for the admission of the patients. So laboratory parameters plays a very vital role in deciding a physician either to admit the patient or not. There are some rules like medical advices. So against medical advice, EMA left against medical advices. And what are the rules for food? What are the rules for taking medicines like before food, after food, or how much time it takes for therapeutically digestive in the body? Like digoxin is taken every 36 to 40 hours. So in a week, you can take 5 digoxin tablets. Then pharmaceutical jurisprudence like narcotic and psychotropic substances, magic remedy acts. Okay, so there are various rules law concerning this one. Treatment, pharmacological therapy, emergency treatment. So every part, when you look after for this one, so you will concentrated level, you will find that the hospital is one assembly. This one term is derived from a Greek word, which is named as hospices. And hospital means where you can have the food, you can have the rest, and you can have the medicines, you can have an extensive care of the patient. That the term hospital is derived from a Greek word, hospices. So when you are residing in the hospital, hotel or hostel, You are students, you are residing at hostels, you are having a food in the mess or hotel or hospital. So everywhere you will find at 3 places there are some things which is giving relief to your body. Okay, so this is the term derived from the Greek word hospices. And I will see the definition, classification of hospital, primary, secondary, tertiary hospitals, classifications based on the clinical scenario, classification based on to the non-clinical basis. Okay, so this all way we will be looking after. Okay, so based on to the non-clinical and clinical basis, we see that what is the particularly aspect of the hospital. So when you enter a hospital, there is a parking area first of all. Then you go to a help desk. Then you see a roster, OPD slip registration counter. You go to the patient waiting area. Then you move on by walking. Some lift will be there, or some what I can say is some stairs may be there. Then you might find blood bank, chemistry department, therapy room, occupational therapy room, demonstration room, wards, pharmacies, laboratories, central sterile supply unit, and medical record department. So basically the hospital services you find, basically there are a couple of types, IPD and OPD. IPD means in means when the patient is admitted. Every patient has to undergo both OPD as well as IPD. So if the patient is having a chronic disease state, then the patient has to particularly go for the IPD. But once it is acute or subacute, it means the disease state is not that of much crucial or severe that the admission is required. So OPD and IPD. Diagnosis is on various criteria like biochemical in your body. You have enzymes, hormones. You might have understood with the subject called biochemistry, medicinal biochemistry. And in this biochemistry, all the nitrogen cycle, urea cycle, oxygen cycle, this all cycles tells enzymes, hormones activity, how the metabolism of this takes place. So the biochemistry of the body. Hematological, heme is a protein, blood, so complete blood profile. Hematocrit, hematuria, hemoglobin, WBC, RBC, eosinophils, white blood cells, etc. So hematological estimation in case of diabetes mellitus, HbA1c again. So blood related any kind of whensoever there is one test comes up. Then the radiological X-rays, bones comes up. Then the computed tomography, that is CT scan, then PET scan, positron emission tomography, MRI, magnetic resonance. So this is used for various neurological disorders like Huntington, Parkinson, Alzheimer, MIMO. So the definition is of hospital. WHO expert committee is given a hospital is a residential establishment which provides short-term and long-term medical care consisting of observationals, diagnostics, therapeutics, and rehabilitative services for persons suffering or suspected to be suffering from a disease or injury. And for the pertinent, it may or may not also provide services for ambulatory patients on an outpatient basis. So typically, the organization of the hospital where you have to give the information services, you have to give the diagnostic services, you have to give particularly the supportive services, you have to give the admission, billing, medical record, computer information, and OPD, IPD section, human resource section, where you go for the physiotherapy, diet therapy, balloon therapy, radiotherapy, chemotherapy, operation, minor major surgery, diet clinic studio. If the person is not able to speak up after the birth or stammers, so stammering, so speech therapy, language therapy, some tongue twisters. So occupational therapies takes place. In terms of diagnostic services, hematological, radiological, biochemical, neurochemical, cardio, mammography, etc. takes place. In services, research and ethics committee, central sterile supply, biomedical waste, housekeeping, maintenance, dietary, medical transportation, where bike ambulance, air ambulance, road ambulance, and casualty events, etc. are being administered. Let me tell you, Hyderabad is one of the city where more number of accidents takes place. So in Hyderabad, there is a startup called Stand Plus. In Stand Plus, they reaches in 10 minutes wheresoever there is a site of a roadside accident. So in India, Emergency Medicine Research Institute in Hyderabad established. GVK Reddy and Government of India has opened this one of the emergency medicine services, 108 ambulance, where you can take care of the people's. Organizational structure of hospital of the present time is a complex maze of committees, department, persons. So as I told you, preclinical, clinical, paraclinical, postclinical, every people sit on the table on various committees, various OPDs and outPDs departments like neurology, ophthalmology, dentistry, respiratory, TB and chest, cardiology, nephrology, gynecology and obstetrics, then nephrology, then alimentary system, then particularly dermatology, skin and VD, then a number of major organ systems. You will find out that there are a lot of people governing with the main organization of the hospital, which includes administrative staff, medical staff, associated medical staff, supportive paramedical services, and staff services. So this is one of the thing where you can see that there are physicians, there are nursing staff, there are pharmacies, there are pharmacists, there are physiotherapists, there are dietitians, there are n number of people working day and night to cure the patient. So 24/7 into 365 the hospital opens, hospitals. There are 3 shifts in the hospital, which of 8 hours, 8 3 24. So as per the Bhore Committee classification, 1957 WHO classification, is classified into regional, intermediate and rural hospital as the indicates, where the medicine, surgery, etc. intermediate. Regional hospitals like Government Medical Hospital, like PGI Chandigarh, PGI Rohtak, or AIMS Bhopal, AIMS Bathinda, AIMS New Delhi, etc. Remote hospitals with PSC and CSC services. Again, the classification of hospital is based on the objectives like general, special, like Sankara Eye Hospital is for the ophthalmology, or if I say some cardiac hospitals like Delhi Care Hospitals of Dr. Lal, 11 in India. Teaching research hospitals where the research takes place, clinical trials, post side, or particularly MS or MD people used to do, or PhD in medicine as well as pharmacy practice, based on administration, ownership, control, or financial income, where the peoples are being based on to the GOs or NGOs or semi-government hospitals or voluntary agency services. Based on length of the stay, the days like short term and the long term, it's for 1 month, it is short term for more than 1 month, long term. And then the depending of the type of the medical staff, either it is closed staff hospital or open staff hospital is also one of the concerns. Next classification is based on the bed capacity, which is a small hospital or medium hospital. So up to 100 beds or more than 100 to less than 300 beds. Large hospital is more than 300 beds. Based on the type of care, primary care, secondary care, or tertiary care. Then by teaching affiliation like teaching hospital, non-teaching hospital. Based on the system of hospitals like Ayurveda, Unani, Siddha, homeopathic, and complementary alternative medicines, hypnosis, and mud therapy, various other therapies. Based on to the regionality like regional hospital, Jila, Tehsil level, block level hospitals, or primary health centers, community health centers, critical health centers, civil hospitals, community clinics. As per the WHO classification, regional hospitals, intermediate hospitals, district hospitals, rural hospitals. Other types of hospitals are like Rotary Club hospitals or some memorial hospitals like Tata Memorial Hospital or Padar hospitals in the memory of the Nargis Dutt, the mother of the Sanjay Dutt in the Madhya Pradesh, and Kokilaben Mani Hospital in the Mumbai, Tata Memorial Hospital in the memory of Tata's Jamshed Tata. So such kind of memory hospitals, public sector hospitals teaching research, special hospitals, private hospitals, semi-government, autonomous, corporate hospitals, mental asylums, voluntary agency hospitals, pediatric hospitals, geriatric hospitals, nursing homes, home care review visits hospitals, then the mobile hospitals and mammography vans particularly are. According to the level of care, primary care hospitals, day-to-day healthcare given in a healthcare provider. Typically, the provider acts as a first contact principal point of continuing care for patients like Upzilla Health Complex. Secondary care hospitals, which provides in district hospitals this level of referral services. Suppose the chronicity level is more, so the referral takes place at the services and which is beyond the scope and capacity of the primary level. And the level is assigned to provide some specialist services where you see the general medicine, gynecology, pediatrics, geriatrics, gastroenterology, hepatitis, hypertension, diabetes, angina pectoris, myocardial infarction, or in ophthalmologic, if I say this conjunctivitis, glaucoma, pink eye, and many more diseases comes up in respiratory, if I say asthma, otitis media, emphysema, laryngitis, pharyngitis, tonsillitis, etc. So, tuberculosis, then particularly your a number of diseases which takes place, hay fever due to the allergies, allergens, COVID we witness now. So secondary care is more important. Tertiary is like very hospitals having high specialties at the regional or the peripheral central level. Like All India Institute of Medical Sciences, New Delhi Cancer Hospital, Pandit Jawaharlal Nehru Hospital, Cancer Hospital at Bhopal, infectious disease hospitals, mental disease hospital at the psychology part. So this referral hospitals provide to support to the primary level and the secondary level of healthcare hospitals. So hospitals do have a lot of functions like intramural, extramural. So mechanical maintenance, electricity maintenance, manpower maintenance, law maintenance. There should be a control room. There should be some codes to control the threats like bomb threat, fire threat, or particularly a number of threats are over there which governs. So services, a lot of services, community medicine camps are taken up at various places in the community. Immunization services, vaccination program, national health programs, diagnostic services in terms of diagnostic, preventive care, prophylaxis, rehabilitation, smoking cessation, care of emergency, antenatal and postnatal services, well, baby clinics, immunization schedules, family welfare services, control of communicable diseases, health education, etc. Then continuing pharmacy education program for medical as well as pharmacy. So CEP, community health education, multi-specialty, paramedical education, this all takes place. So clinical medicine, hospital administration are one of the part which takes place. So clinical research, maybe a hospital can be a site for the same, or if the research center name is allocated within the hospital. So this is one of the important thing for you guys to understand that the hospital is of high gravity, and in particular case of preventive health, rehabilitation, prophylaxis, various lifestyle modifications like dietary changes, alcohol and smoking cessation clinics, mobile de-addiction clinics, emergency medical services, and CMEs, health screening services, capillary blood glucose, cell blood glucose monitoring, vital signs monitoring, nutritional counseling, promotions of national health programs like health education, patient education, healthcare research, child and maternal health, integrated disease surveillance program, etc. takes place. So, my dear students, from this first lecture, what the questions can come in your examination is like define hospital, enlist types of hospitals, give the role of diagnostic services, give examples of associate medical services, enlist therapeutic services, enlist supportive paramedical services, define term coordinator, what do you mean by allied hospitals. Then in long answers, it may come like give the functions of hospitals, draw the block diagram of organizational structure of hospital, add a note on support services, explain in detail classification of hospitals, add a note on informational services, explain the current scenario of the healthcare systems in India, where is very long answers. history of hospitals, node on medical staff, node on pharmacy and therapeutic services, organizational structure of hospital, add a node on primary, secondary, tertiary, and quaternary hospitals. So I have authored a book of 7th semester, which is being published by Nirali Prakashan as per the strict compliance of Pharmacy Council of India syllabus, and the code is here, this one. And as per the syllabus, you can go for the Merchant S.H. Kadri, Parthasarthi G. Williamson Hanson book, Tipnes Bajaj book, etc. And you can also follow some journals like for therapeutic drug monitoring, Journal of Pharmacy Practice, American Journal of Health System Pharmacy, Pharmacy Times, etc. So thank you so much, and I would like to thank Abhishek and Kamaljeet for helping me out in this first broadcast. So if you have any questions, you can write in the chat box from this, and I will see in the chat box and will answer you. Okay, Abhishek. So thank you so much, and at the same time, from tomorrow onwards, two classes takes place, and we'll definitely join on to the time sharp 7 o'clock every day till 30 September. Thank you so much.